Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center, and today is the 7th of November, 2023, and we meet every week at 6 o'clock, where we take your questions by email. If you go on tlcdoctors.com and get on our email list, you can email questions into us, and I get these delivered to me right after work, and so uh, I don't have a chance to see them ahead of time. So you're getting me as fresh as I can be. I've been here since 7 a.m. working. Anyway, we will try and answer all your questions, or at least from the point of view from a functional integrative medicine point of view, as you do ask them. And I may or I may not know the answers or have some good recommendations, but this is not meant to be personal medical advice. Instead, this is to give you an idea how a functional doctor, integrative medicine doctor thinks as they hear a question or are proposed a problem with some health issue. If you have your regular doctor, you should see them if you have acute problems. Of course, if you're a patient here, please call and have your doctor call you back or make an appointment to address these issues. But this is a generalized response, not meant for individual instruction, even if you are one of my patients and even if I know who you are by your name that you put out here. The other thing is we have a chat, a live chat, and I will defer to the live chat for the people who are here live with us. I also have, if you're on YouTube and you can write in on the chat, that's a nice way to ask questions. Uh, Another way you can do it is at the end of this, or if you happen to watch this later, there's a comment section below. You can put some questions there. I do look there and try to give an answer briefly and so forth. So all these things are available to you. Why do we do this? We're trying to keep you healthy. We're trying to reduce the healthcare costs. We are fearfully and wonderfully made, and so our bodies are designed to heal. Our bodies are designed to prevent illness, and so we acknowledge that, and it's a magnificent uh, construction from our Creator. And we want to promote that, especially in these times when we're all trying to save our pennies, as well as we here are trying to survive and stay afloat as a clinic. Now, we will begin with our live questions here in the chat as I see them typed in. And we will begin with Joyce. Joyce states the word shingles. Um, I am a TLC patient, A-type blood. But Joyce, what is your question? So maybe something you thought was typed in didn't get typed in, but a lot of people will be experiencing as the fall and the darkness and the lack of the ultraviolet light from the sun that we usually get between 10 a.m. and 2 p.m. That will hit the skin and help convert our cholesterol through then the renal area and then generate our vitamin D, which is really a hormone that helps boost our immune cells, our white blood cell functions. And vitamin D should be used, but vitamin C is a water soluble, whereas vitamin D is a fat soluble. So the water soluble vitamin C has been shown, and there are studies, even NIH studies, that it's valuable in alleviating the shingles pain of an outbreak, which is the varicella virus kind of coming out along a dermatome. So we have nerves, and these nerves have one-sided effect, a right side and a left side. And if you get stressed or your immune system drops off because you're not getting enough vitamin D, you're not drinking enough water, you're not exercising, you're not getting a good night's sleep, you're eating too much sugar, starch, bread, pasta, cracker, uh, mashed potatoes, French fries, whatever you're eating, hydrogenated fats. If you are suppressing your immune system with all this sugar and during the season, the marketing and the propaganda put out to get you to buy and eat and consume and celebrate over food everywhere you go with everyone you know. Take a picture of it, brag to a friend so you eat more and eat more. And then they fill it full of high fructose corn syrup. And that is some of the most addicting, driving, but never satisfying. So you eat more and more. And this suppresses the immune system and you can get the shingles. Now, these processed foods are lousy foods. I wouldn't even honor them with the name of calling them a food. And so we have taught for decades our patients here that the foods we should be eating are the healthy fats and proteins. We are composed of fat and protein. We are not composed of fruits and vegetables. We don't have any essential requirements for carbohydrates. So vitamin C is even in organ meat. Like, this is Tuesday. I had my liver and onions, and that's my one meal today. I had a huge, big piece of liver and onions, and that's all I'm going to have today. And so that thing is full of all kinds of wonderful things, collagen and minerals and vitamin C. Yes, vitamin C. So you don't see any of the Inuit Indians, Eskimos getting vitamin C scurvy issues. So yes, by eating the liver of whales and fish, you can get your vitamin C. And we do have data that is shown in NIH that it is linked with alleviating the pain of the post-herpetic neuralgia of shingles, where the virus crawls out along one of the nerves in the dermatomes that go down your spine, where the nerves come out on each side. High dose vitamin C intravenously is a great way to do that. Taking oral vitamin C, 1 or 2 grams, maybe up to 4. Some people can take more. Usually beyond 4 grams, you'll get diarrhea. Vitamin C is associated with helping stimulate the immune system and enhancing your level of protection. It is associated with some antiviral activity, and it's associated with having inhibitory effects on some stems, or at least, to my knowledge, all the stem cell studies on cancer stem cells have been inhibited by this. So we have here the high dose vitamin C immune booster IV. You can have it in an hour with all the wonderful minerals, with zinc and magnesium in it, and it has the methylated B in it, B12, and it has the high dose vitamin C. It's a great way if you sense you're getting shingles or a cold to call up the office at our clinic, Tustin Longevity Center, 714-544-1521. Ask for the IV department and schedule a vitamin C drip. If you're not a patient here, we do take walk-ins, and the nurse will do an assessment. We doctors are here, and if she has any question or not whether you can take it, she'll contact us or he'll contact us. And we don't give as high a dose to the walk-ins as we do to those who are patients here, because we do have your labs and we can push the limit. You do have to have a G6PD, which is a enzyme that is known to help with the metabolism of vitamin C. And so, yeah, you can get vitamin C as a walk-in. You can get EDTA chelation therapy as a walk-in, but they are at a lower dose range. But yes, Joyce, if that's what you're asking, shingles would be helped with vitamin C. Of course, it's helped with a low-carb diet, good night's sleep, exercise, not eating late, intermittent fasting. Intermittent fasting promotes sugar control, and so that will help prevent these viral challenges. eating rich protein and healthy fats, getting away from processed foods, and so even if you get to stressful times, you can fly through them. Like our clinic here over the alleged COVID pandemic, we really had no serious patient illnesses at all, because all the things you hear me to advised right now on it were in fact attenuated. We are all low carb. We all have the vitamin C drips. We're all on vitamin D, or we take a multivitamin with zinc in it, and we are trying to all exercise, get a good night's sleep, drink plenty of water, those kind of things. So hopefully your uh, question, Joyce, on shingles was what I covered. You put here that you're an A negative blood type. A's, again, as a class of people, Joyce, don't tend to digest food as well. And if you don't digest food as well, you don't reconstruct and repair your cells as well and get minerals extracted from the foods you eat. So when I now, hitting 70 years old, when I ate my liver today, I take my orthodigestive enzymes. That would be something I would have anyone over the age of 55, 60 to do, or certainly all blood type A people, even into childhood. But talk with your doctor. Children tend to have uh, decent digestion, but some kids who are A-type blood have a lot of tummy aches, and they can be helped with a little bit of digestive enzyme support also. Let's see. Pere Lynn says, what is an integrative approach to acid reflux? Peri, am I saying that right? Peri Lynn. Well, the integrative approach to acid reflux is to stop it. And you do that by not eating late. Normally, the stomach will tend to empty itself out from the stomach into the duodenum and small intestines after about 3-4 hours. If you're a diabetic, you start getting gastroparesis, slowing down of the movement and emptying, and it can take many, many hours. The older you get, the less digestive enzymes you have, the longer it sits in your stomach, and can be 6 to 8 hours if you're just older. And then you go eat a dinner at 7 o'clock and you try and lay down at 10, and you're constantly getting some of this partial stomach fluid burping up into your lower esophagus, giving you heartburn and reflux and irritation. And the sphincter there, the sphincter between the esophagus and the stomach sac, is also, you might say, stretched out, especially in women when they're pregnant. It puts tension on their stomach when they're eating, and the pressure there. So all these things are an issue. So being overweight, eating too late, being older, and having blood type A, that would be a big setup for reflux. So we tell people, try and change your lifestyle so that depending on your age, I try and stop eating by 4 or 5 o'clock. And I do take my digestive enzymes, but I am a B type blood, B positive. But because I'm older, and I'm always working under stress, decade after decade after decade, stress, cortisol will also slow down digestion, because when you're stressed, the signal is to work on fight or flight issues and blood flow to my body and my brain. Cortisol will inhibit the digestion as well. So there are many factors that go into reflux. So don't eat late. Number one, don't eat late. Don't even drink sugary fluids and stuff, because that will slow your stomach digestion down. If you're an A-type blood, take digestive enzymes. If you can, take a nice little 20-minute brisk walk, half-hour walk after all your dinners, if you do eat dinner. The other thing besides enzymes and a walk and not eating late would be to, let's see, what else? Elevate the head of your bed. And then for repair, to stop the reflux, elevate the head of your bed. And what do you repair with? Well, if you have injured materials in the esophagus and at the junction between your esophagus and your stomach, these injured membranes are one cell membrane thick, and they're composed of phospholipids and proteins. So what you should be eating are phospholipids and proteins. So that's why we make the phospholipid powder and the SBI Protect powder. Now this top one here, the probiotic powder, is not really absolutely necessary, but at least these two, this is the phospholipid of this repair, so the whole damage in the membrane here can be fixed to this nice smooth double bilipid membrane. So this is the fat phospholipids and this is the protein, and you take a scoop of each and put it in water, take it before, and I would make the water warm. I'd put it in warm water before you go to bed at night. I always find it works. And my patients, I have mine on my little kitchen counter here in my office because with my stress, I can, I used to joke about I take 75 supplements a day. And that's because I take 25 and I burp it up two or more times and I have to swallow it again. And so the total re-swallowing of them makes it 75 that I have to swallow. And I noticed that because of the stress in my life and after having children, that really put a huge stress on my body. But hopefully that'll help you understand what we would do for acid reflux. Michael says, if someone has low testosterone, would it be okay to be on testosterone replacement therapy? I would say so, Michael, unless you have some serious prostate cancer where you should talk with your prostate urologist or your oncologist. Although more and more papers are being written that testosterone really is not being believed to be as linked with negative impact on the prostate. But anyways, if you're on a prostate blocker hormone suppression treatment for prostate cancer, then you shouldn't take testosterone. Yeah, so if you're just low and you don't have prostate cancer, I would definitely use it. But why not try an exercise? And exercise will build it up. Have your zinc levels checked, or forget the zinc level and just go ahead and take, 25, 50 milligrams of amino acid chelated zinc. Because low zinc levels are associated with that. And I find this very commonly in my adult men. Also, the time of the year that you test your testosterone. So right now, testosterone should be about its highest it's going to be in the fall, so that all the male animals and all human men are on a biannual testosterone phase. So testosterone raises up in the fall, and then after about January starting, it starts to decline all the way until about May. And in May, then it starts building up again. And why is that? Most of the animal kingdom will carry their pregnancies through and have them born in the spring. And God did not want the male adult animals to eat the pups. So God lowers the testosterone throughout the animal kingdom, and you'll find that the time you get your blood tested. So if you test your blood, in February, March, April, you're going to see the lowest level, and then you might want to exercise and take zinc and eat a healthy protein, healthy low carb natural fats, and then retest it in the fall, in September, October, November, and maybe it will be good enough there, Michael. Denise says that her husband was diagnosed with paralyzed vocal cords. Any alternative treatments available besides surgery tracheotomy, or cutting apart of a vocal cord. Throat is dry and restricted. Pain if he tries to speak. Thank you. Well, Denise, this is too complex for me to jump into with any statement about what you should or should not do. But if someone came to me and they were diagnosed with paralyzed vocal cords, we would want to find out why did that happen. And so with your otolaryngologist and watching over you, because we don't know the cause, that's not common. And it usually isn't bilateral because there's two sides of the innervation there. Very often, what we would tell our patients to come alongside nutritionally and immunological support to the specialist, the ear, nose, and throat surgeon, and the internist is I would do some fasting. If you would go on a 48-hour fast and just have nothing. Very often, this will prevent reflux, which could irritate things. It will improve the immune system. If there's a viral illness, taking a high-dose vitamin C drip would be helpful. Taking vitamin D is helpful. And I would do this protein for a quick, powerful support, the phospholipid and the SBI protect protein with the immunoglobulins so that all the gut-associated lymphoid tissue that's about 70-80% of your immune system lines this area here. If whatever is causing that paralysis, you're going to boost your immune system immediately. So start with a 24 to 48-hour fast, just a water fast, unless he's an insulin-dependent diabetic, of course, because they would have to be under the close management and discussion of any fasting with their doctor. But that's how I would tend to begin the support there. The fat helps the sheath lining the nerve is a cholesterol-rich, phospholipid-rich lining around the nerve. So it makes all the sense in the world to have the phospholipid in there. And then after the 2-day fast, I would eat organ meat, prime rib, roasted free-range chicken. I would eat salmon, buttered up. And I would try and stay away from plant foods. The reason being, there's such a huge need to stimulate healing of the nerve. What you need is the cholesterol and the phospholipids and the proteins to promote the healing of the sheath. So that's a beginning thing there. And then find a good functional doctor and work on that and get on some vitamin D. And that's the beginning way we would start anyway. Let's see, what's the next one? CC says, do you recommend Juice Plus Omega Capsules or will eating healthy animal fats suffice? I have not been using the Juice Plus Omega Capsules because I'm driven by the science. And I think one science paper has come out on the omegas, the fatty acid capsules in the Juice Plus series. And I respect all the science in Juice Plus. The paper was, interesting. It was favorable. And so I'm not against it. And I am for clearly the science that I do know. I happen to use clinician's preference oil, which is the omega 3 and 6 of the only 2 essential fatty acids, linoleic and alpha linolenic acid. And that's what I use. Eating healthy fats and animal. Yeah, if you eat the egg yolks and you eat some meat and fish and chicken, and you could have nuts and seeds like flax seeds, sunflower seeds, walnuts, pecans. That would be useful too. Okay, Robert says, I am suddenly experiencing muscle pain over the few weeks. I eat a low carb diet, drink water, take enzymes, and do intermittent fasting. What is causing this? I will be doing a 5-day fast soon. I'm suddenly experiencing muscle pain over the few weeks. And then he goes on to say in the next comment, I first saw you back in 2008, and I have been taking Juice Plus red, green, and purple since, and continuously taking it that long. What benefits do you think it has or given him? Well, I think it's protecting your DNA damage. And I'll just tell you, there is no one study that says, let's see, I've been on Juice Plus since 1999. So how long is that? 99, 2009, 2019, and so about 25 years. And I feel wonderful and thankful in my 70s now to have this enduring energy. I will tell you that the owner of Juice Plus, I think, is about 90, and he's still working, and he's still all together. And of course, he tries to eat a healthy lifestyle. I think he avoids alcohol for the most part. But in general, I am surprised at all the people that when I joined, let's see, I was about 48, maybe 49 when I joined. And 25 years later, the people who were in their late 60s, they're all still alive. I don't really know but one or two that have passed on. And that one of them was by an accident. So I have to tell you, I am totally impressed with the longevity of people who use Juice Plus and who use it continuously over the years. We have more than 42 studies now. It prevents DNA damage. We have several studies on that. It boosts the immune system. The childhood research involves now millions of children over more than 10 years. Less day miss at school, less medicines prescribed for their doctors, less allergies, better academic performance, better athletic performance, less cravings or a better diet in general. We have cardiovascular benefits from it. We have just so many studies on Juice Plus. It's the most researched nutraceutical. So that's why I stay with it, Robert. Now, regarding your muscle pain all over, you have to see a doctor, Robert, and you have to have someone look at you, look at maybe some CPK enzymes. These are muscle damaging enzymes. Ask about any vaccinations you may or may not have had recently, any viral illnesses you may or may not have had recently, and look at general autoimmune screens and look at it that way. So please go see your doctor and let us take a look at you, and hopefully you find a good functional doctor that can do that, Robert, because you bring us so many good jokes. We want to take care of you and have your blessed presence and joy and wisdom as well. Okay, let's go to some of the email questions. Okay, the first one on our many pages today, I don't think I'll get through them all. Cynthia says, what would you recommend to do a week before surgery to prepare the body as much as possible for a quick recovery? What would help after surgery? Thank you so much for your time. Well, I would say I see this question was one of two I apparently didn't get to from October 31st. You probably had your surgery already. But in general, for surgery, I tell people to go off onto an extremely low carb diet and eat rich, free range beef, roasted chicken, salmon, and have lobster, crab, sardines. And if you're going to have vegetables, I would have the cooked broccoli, Brussels sprouts, green beans, asparagus, things like that, only buttered with salt and to taste. I would never eat past 5 or 6 o'clock, and I would start eating around noon. So there's a 6-hour window, because that'll stimulate your body to heal and build itself up and get all the protein building blocks. See, when you're cut in surgery, you need a ton of protein to repair all that damaged tissue. Most Americans don't eat enough protein in general, so eating a rich, free range, wild caught protein diet is very important preoperatively. And then the other thing we would say is the day before surgery, they often tell you don't eat for 12 hours before surgery. I ask my patients not to eat for 24 hours before surgery. And most of my patients can do that because they've been seeing me for decades. So they're already used to a 24, 48, 72-hour fast. Why? Because that stimulates human growth repair hormones. So you get a jump start on all the somatostatins that will promote healing after you have the surgery done. The other thing I tell my patients, if they're on the systemic enzymes like Vitalzyme or Vascuzyme, to stop at 4 or 5 days before surgery, because that will thin your blood and prevent blood clots. And that's the streptokinase, nanokinase, those kind of enzymes that are anti-inflammatory. And we stop it not because it's going to really be harmful. It's just for the surgeon. I have seen patients who were on enzymes, and there's a tiny, tiny little oozing of capillaries, and he has to cauterize those little spots. And so, to be nice on the surgeon, to have less bruising, you should stop those systemic enzymes about 4 or 5 days before surgery. But the next day, the very next day, you should double it. So if you were on 4 or 5 a day, I would take 5 twice a day. And I would do that for 2 weeks to clean up the post-traumatic insult injury of inflammation from the surgical incision site. And then that helps with the being fasted. And I wouldn't eat the day after surgery. I would just have chicken broth, beef broth, not bone broth, chicken and beef broth, like the bouillon cube thing. And because if you can make it the next day and just rest and sleep a lot and just sip on these broths, that will be another stimulus for more growth and repair. So whatever surgery you have, these are the best ways we recommend approaching it. And you can have your multivitamin, your mineral, your digestive enzyme. You can have your vitamin D. You can take your vitamin C, your B complex. All of these are very fine. And very often they have a swath where they'll say, the surgeon will say, don't take any supplements, before surgery for a week. Well, that's foolishness. Okay. That's ignorance. So, yeah, don't take fish oils because that's a known blood thinner. And the only thing that you have to be careful with are the systemic enzymes, Vascuzyme, Vitalzyme, Proteozyme, that has those things like nanokinase, streptokinase, and stop it about 4 days before, but double it the next day. And then stay low carb as long as you can. Oh, Robert goes on and say, Dr. Merrick is my doctor. Wonderful. Well, have her do some of those things and give her a call, give her a heads up that you're having that issue so she can prepare some lab and suggestions for you. So when you see her, she can have that ready for you, Robert. All right. Dennis says, how long can one fast before muscle wasting begins? I would say it depends on the individual and how much muscle mass they have to start with, what age they are, what comorbidities they might have. So it's a very difficult question, Dennis, in and of itself alone. I would rather say I think it's very safe to go on up to a 3-day fast for most all situations, all people with all kinds of illnesses. Unless, and there's various kinds of fasting. We're talking about a pure water fast right now. So if you're an insulin dependent diabetic, that's a separate category that needs to be managed with your doctor. And certain people with heart failure, congestive heart failure, and things like that, we would want to have them all be followed by their doctor if they're going to do a prolonged fast. Is really anything past 24 hours for food. But after about 72 hours, then you can start seeing some potential for muscle breakdown, but it's minimal. We're talking serious muscle breakdown could start for the average healthy person as much as 5 days and 7 days. I've seen literature on that, but again, it's mostly academic. Ultimately, we have seen people go on these fasts for 3 months, and then that's where there's such fasting that they pass away from muscle wasting. But it'll begin at about maybe the earliest 3 days. We can certainly see some academic evidence at 5 to 7 days, and clearly thereafter. So yeah, it depends on the person and the situation. Let's go to the next one here. Lily says, she put castor oil with heat on her liver, and you broke out with the itchy, bumpy, raised skin on your cheeks. So you put it on your liver, but you had a rash on your cheeks. I put Argentin spray 3 times a day, quercetin, vitamin C, zinc D, 10,000 turmeric, low carb diet, bone broth, tea tree oil, shea butter, and EUCRISA. What are your suggestions? What happened to my body? Is it toxic unloading, allergic reaction? Castor oil is in general, it's used mostly as a laxative if it's used for anything, and that's the oral consumption. It's made from castor seeds, and ricinoic acid, I believe, is what is squeezed out to make the castor oil and process. But the deadly poison ricin, I think, comes from the seeds that produce castor oil. So that's taken out in the processing. I've never heard of any serious toxic risk with castor oil, although its seed is the resin deadly poison. I don't think it's useful. I'm going to say I would rather you fast 24 hours. You'll get a lot more known research on detoxing, body cleansing, if you would go on a fast for 24 hours and drink plenty of water and take your multi-mineral amino acid chelates and take systemic enzymes and take a walk, these kind of things. Castor oil, I don't think is anything really that exciting. And usually if you're going to get a rash, it'll be at the site of the application of the castor oil pack. So it would have been on your liver there. To have something show up on your cheeks, I think is totally different. So I don't know what's going on there, Lily, but I would not, I don't endorse the time and effort of castor oil packs. I know the culture of many well-meaning naturalists say it's beneficial, and there's a long history. I'm not sure that you can justify that with research, although the NIH has done some research on this, a lot, of course, for the poison, resin poison from it. But regarding its benefit, it's really only a laxative, and otherwise it has very low risk for allergy. All right, the next lady is Thel Marie. Following a 4-day drive from California to Houston, Texas, I ended up in the ER fearing I had a DVT, a deep vein thrombosis. But after an ultrasound, I was diagnosed with cellulitis and prescribed clindamycin. That's an antibiotic. And you finished that, she says, what do you recommend I take to complete my healing as I still have swelling, pain, and redness? Well, you've got to see the doctor, and that could be serious. But I would fast. Your body knows what to do when it's fasting. If you would drink a lot more water, we drink a lot more water when we fast, and take systemic enzymes 4 or 5 twice a day, 3 times a day. on an empty stomach. If you do a 24, 48-hour fast, elevate your leg. You know how a cat will kind of pump with his feet and like that? If you raise your legs and you pump your legs to promote circulation and you take the enzymes with the water, you'll see dramatic improvement of the pain even within 5-10 minutes. And you'll know that what I'm telling you is right. Fasting promotes the communication between the cells to stimulate healing. The water helps as a transport medium to remove toxins. The enzymes are your Pac-Man that clean up the junk. I would make sure you're on vitamin D, and I would make sure you're on a probiotic because antibiotics impact your gut good flora. Clindamycin shouldn't have any detrimental effects on muscle and stuff. But if you're still sore and you finished your antibiotics and if there's redness there, I would have the doctor check it again, get your CBC, a white blood cell count, and check it. All right, Kim. I've been experiencing a burning feeling in my upper stomach area after my stomach empties. I wake up in the middle of the night with an empty, burning feeling. I am AB positive blood, and this has been going on for about a week. Just curious what your remedy would be. Kim, it could be so many things. It could be something you ate, or you might think it's a good food, but you're getting a delayed IgG immunofood allergy reaction. It could take a day, 2, 3, 4 days to show up. So a food could be doing this in the slow allergic response. That's why doctors tear their hair out with gut complaints, because it's so hard to help people with gut complaints, because a food you ate 1, 2, 3, up to 4 days ago can create stomach pain that's delayed. Secondly, eating too late. Besides the food allergies, which will delay the peristalsis, and it can make your stomach emptying slow, and that would make your reflux more likely. Not drinking enough water, taking medications or drinks that are acidic, like coffee, caffeine. These could do it. The other thing is having a whatever your age is. Have you had children? The reflux. So what would I do? I would have you use this powder mixed in warm water, 1 scoop of each. And I would drink that, and I would do it first thing in the morning when I woke up, last thing before I go to bed, and anytime during the day. You could do that, several times a day. It's natural, it's food, and that should help stop this. But then I would make sure I eat a diet that is a 1 menu day and have a plan. So my plan is Tuesdays are liver and onions. Wednesdays for me would be like steak and broccoli. Thursday would be roast chicken and green beans. Friday would be salmon and Brussels sprouts. Saturday is often a fasting, 24-hour fasting day. Sunday, I usually will eat something left over if there's leftovers from any of that. And then Monday would probably be just my eggs, buttered, lightly scrambled butter, eggs, and bacon. So that's kind of how I live my life. I eat like that. I try and eat mostly a 1 menu day. I try and eat between 2 and 5 o'clock. And that's how we do it. So why am I saying that? So if you eat a 1 menu day, and let's say you were going to have 2 meals a day, I would make enough liver and onions so that I would have it for my lunch tomorrow to heat up. Or I would make enough beef and broccoli so that you could heat it up for lunch the next day. I would make enough chicken and green beans to heat up the next day. I would have enough salmon and asparagus to heat up the next lunch. You see what I'm saying? That way, if you started doing an elimination diet, you could say, all right, I'm going to eat a 1 menu day that decreases the exposure of spices and all kinds of things that can get into my diet. And then I'm going to chew it real well and take my digestive enzyme and my phospholipids and not eat late, raise the head of my bed. And then you should be able to work it out that way without having to see a doctor. But if that doesn't help you within, a few days, then see a good functional doctor. Let's see. Tori says, I started a pro-metabolic diet in July after 3 years of intermittent fasting, except when you were pregnant and postpartum in 2022. Intermittent fasting worked for years, but in postpartum, I felt depleted, poor skin, chronic diarrhea. The pro-metabolic diet did clear my symptoms at first, but now I'm worse off than when I started. Which diet is best for healing hormones? I'm 35 with Hashimoto's history, SIBO, small intestine bacterial overgrowth of the bowel, and a TLC patient. Well, many women are getting pregnant today not healthy enough. We haven't eaten enough healthy protein fish meat to have all these wonderful membranes here so that we can not only repair ourselves, but build all the membranes in a baby. So we're eating all this junk food, and it puts us really behind the 8 ball. Plus, so much of the junk stuff they call food is mineral and nutrient depleted. With industrialized farming, glyphosated, hydrogenated, high fructose corn syrup, just a horrible situation. And we lose our essential fat soluble K2 and K1 and vitamin D and vitamin E and vitamin A. And so we're having lots of trouble. And then postpartum, depression is often associated with not only then do you have that, but then you're probably breastfeeding. So we need our doctors to get a crash course, not crash, learn nutrition. And they should all get the Connie Netzer Encyclopedia of Food Values. Every doctor, if they're a doctor, should have a food value. So if you asked, is there enough calcium in my body? What foods would be great? And you look at a meat versus a bean, you're going to go for the meat all the time. But if you look on the internet, there is a political correctness where you're not supposed to say meat is the end all be all to everything you need, or liver. And so it won't really bring that up much, but it's fabulous. So how did I get there? We were talking about your pro-metabolic diet. So I would say, about half of all people with Hashimoto's have, or half of the people with small intestine bacterial overgrowth have Hashimoto's. So you have to understand what we eat. If doctors don't understand what you eat matters, okay? And not only on top of what you eat matters, you have to have it organic, free range, wild caught. And you'd be amazed at how satisfying a free range piece of steak every few days for me, eggs, salmon, my liver day, my roasted chicken day. It is so satiating. And that's how I can have fasting blood sugars in the 50s and 60s and low hemoglobin A1C, low insulin, and low triglycerides. It is so satisfying. And I'm just like you. I can become binged on carbohydrates. Thank the Lord I didn't have any Halloween candy. I did get, my son went out and got some coconut almonds, little mini things for the kids. I don't support Halloween at all, but we do open the door and we give them little Bible tracts and give them a little something. And I did not touch that stuff, but I'm like you. I would binge it away. I would binge it away. So you have these instinctual limbic guttural survival drives that override for sex, for defense, fight or flight, for salt, that taste salt, sweet, and butter, fat. These guttural drives in us are what these New York advertisement companies capitalize on, paying up to billions of dollars for marketing to us, getting psychological profiles, how to image color reactions, all of this to get you to consume their stuff. And it's not satisfying. You had better get angry, and you had better start developing a healthy image about how you're going to defend yourself. So if I go to a place that you call a grocery store, I call it a pornography store for your mouth. I call the grocery store a pornography store for your mouth, and that it's killing our children and our young men and messing up their hormones, and they're never satisfied. They're all driven through Instagram and marketing. How did I get on that? Pro-metabolic diet. But anyway, so you have to, I would really get away from any packaged food, breads, crackers, all that stuff, not to mention, candy and soda pop. And I would eat real food, learn what eating real food regularly and how satisfying it is. And see a good, you are a TLC patient. Okay, well, why don't you talk with your doctor, and if you're not satisfied, have your doctor here at TLC bring your case up at our grand rounds. We do that once a month, and we bring up cases. And this video thing and what we're doing is helping us doctors so much to get a wide variety and get we're measuring the amount of hits on topics, so we know where we need to drive our training. So we're working on this in the background. I'm coming out with a teaching for physicians, and we're starting to focus on areas of greatest interest. We have to teach you that you're responsible for your health, and we have to teach you how remarkably well your body will heal itself if you can get it off that bronco of food bouncing you around, and turn, every time I go out the checkout, I feel like I'm going into a, a pornographic aisle, not just the magazines, but all the candies like Reese's peanut butter cups are screaming to jump into my mouth. And I have to think very evil thoughts about it, and how evil that is to do to me every time I need to get a simple piece of good food. That's so wrong. That's so evil to do to me. And everyone, and I feel so sorry for my patients. All right, I went on a rant. I should be answering questions. Okay. Linda, I have a friend who has a 1.8 centimeter liver lesion on the left extrarenal pelvis. What is this? Linda, that's too little of information, and that's too important to miss. So you need to bring that up to your doctor. Now, it's very often to see cysts in the liver, especially as we get older. Just like we sag, and wrinkle, and our skin wiggles, your liver's hanging there right under your right lung, and it's sagging too. And it can, pop, smack, and a little cell opens up and the tissues tear about, and you get some cysts. Okay. And that's benign, but it could be so many other things. This isn't enough information for me to go beyond that, but hopefully it's just the most common little cysts. And then Linda says you have a friend who has had 2 pulmonary embolisms, one while she was on an airplane and another just recently. How did these develop? Well, it's not enough water, because we're made mostly of water. Pray, everyone, that I can get a glycocheck, which is a machine that will help me to demonstrate to you how important EDTA chelation therapy is. This is like a hook or device with a camera on the tip, and you put it, hang it on your mouth like that, and it takes a picture of your veins and arteries right in the mucus on the floor of your mouth. Just like you get a hand identification when you go to Disneyland, and some of people have that as they take a infrared picture, and it's a very unique identifier of your veins. Well, I can take a picture under your tongue with a glyco check, and I can see living, flowing blood cells through a capillary, teeny weeny capillary. And I can calculate the flow dynamic of that one red cell trying to squeeze through and feed all the cells in its domain and take up all the garbage. It's a lot of work for that little capillary to do. And if the membranes are injured or broken, or you're not drinking enough water, or you're eating sticky, gooey carbohydrate starches, pasta, beans, rice, too much fruit, sugar in your latte, frappe, plape, whatever those drinks are called, and that's going to make it sticky for that little thing to pass through, and they'll clump up. You can actually see this. So pray that I can make enough profit here that I can get this machine, that I can do it, so I can do it on all my patients, to reinforce and come back at that marketing and come back at that terrible place called a grocery store that's really a pornography store for your mouth. And I can show you live flowing what water would do, chelation therapy, enzymes, a low carb diet. I need to be profitable, but I will trust the Lord. He has provided for me well. All right. All right. And so how do you get these pulmonary embolisms? Well, a lot from just inactivity. The blood flow is sluggish, and you're not exercising, you're not drinking your water, you don't make the enzymes as you're aging, and you're gumming it up with so many sticky sugars, and you have antigen antibody sticky complexes from food allergies. It's a recipe for a blood clot or an embolism or something. So our patients, I never would see that until we saw something come out in December of 2020. This something that came out that you would poke into your body, and then all hell broke loose. And I have seen nutty, crazy things from children to adults. Not my patients really so much. Not one of my patients really suffered, especially if they do chelation, drink their water, take an enzyme, low carb diet. So yeah, sticky blood like that. Alexis says, hi, Dr. Ellithorpe. I recently heard about the connection between SIBO, small intestine bacterial overgrowth, and thyroid medication, Synthroid. I potentially have SIBO and I'm taking levothyroxine for hypothyroidism. I don't have an issue with motility, so I am wondering if this even pertains to my situation. Thank you for all you do. Well, here, it's not the Synthroid. It's the condition of why are you hypothyroid? And hypothyroid people tend to have a slow motility and bacterial overgrowth, and too many bad bacteria, not enough good bacteria, lack of water, too much sugar, feeding all the bad guys to grow and be popular. And so you get this overgrowth, and people who have that have damage to this wall of the intestine, then you get breakthrough and irritation of the gut-associated lymphoid tissue that creates immunologic mimicry of molecules that cross-react with your thyroid, hypothyroid attack, cross-react with the joints, and you get arthritis, cross-react with your nerves, and you get MS. So look at it. It isn't that we don't need our specialists, but if we had far more good doctors trained who could help teach these patients, we'd have far healthier people, far less need for all these specialists. And we need to get these specialists trained to help their patients eat right, so their specialty skills, and I want a specialist if I need it, and I refer to them. But we only, there's maybe 1 million doctors in the United States licensed to practice medicine. Out of that million, only about 200,000 of us are general practitioners. The 800,000 are all specialists. This is wrong, folks. This is wrong. This is a recipe for just say, come on, let everyone get sick, and we'll make money as you come by with your illnesses. No, we need 800,000 good doctors who will enjoy the love and lifetime support of supporting a community of people. And then these people will love, and the doctor will love them, and they may not have a Mercedes, or they may not be able to fly to Cancun. Fine. But they'll be the happiest doctors in the world, and they'll sleep like a baby at night, and they'll look forward to seeing you most of the time. And hopefully we'll be in a good mood most of the time, because I know I can be crabby too. Well, anyway, this is 7 o'clock, 7:02. We've gone over. And I got through only one page. But let's see, do we have any other here? I got through to, Dennis, how long can one fast before muscle weight? No, I got through all those. All right, my dear folks, like and subscribe, pray for us here. We have a wonderful new doctor coming along. So excited to let you meet her. We're going to have lots of new things coming to serve you, because I'm the happiest when you're taken the best care of. So like and subscribe, share this. Please put something in the comments, and have a blessed week until I see you next Tuesday. God bless. Goodbye.